Many of us have walked through the halls of a hospital, sat in waiting rooms, or even been the patient lying on the bed. And though we're often too preoccupied to analyze the space around us, we still reap the benefits. Each room, office, and hallway has been meticulously designed to provide the best experience, all while going unnoticed by the very people it serves.
Healthcare is a consumer industry. There are so many different places that you can go to get your medical care, and you want to choose the place that feels right for you and the place that feels like it's going to give you both the best results, but both the best experience.
That's Jodi Feldheim, a principal architect of health planning at HDR Architecture. She's spent nearly 2 decades designing healthcare buildings and says one of the biggest changes to medical architecture is the focus on integrating nature into these spaces.
The way that we used to design inpatient spaces would be, sort of no windows, no access to natural light, anything like that. And so we've started figuring out that nature is really helpful in healing. So daylight, all those kind of things really became very significant starting then, right? And sort of evolving over time.
That research first came out in the 1980s and has continued to be a cornerstone of medical design. But while that's lasted the test of time, nearly everything else seems to be evolving. For example, Feldheim says hospital rooms are getting bigger to account for innovative technology in both patient spaces and operating rooms.
Operating rooms are much bigger because there's lots of equipment in there that didn't used to exist, and lots of specialized equipment. Another way that we've changed the way we design over the last couple of years is that there's a lot more things that are brought to the patient bedside. So, when you used to be in a hospital, you would sort of be in your room and they would take you somewhere for your surgery, and they would take you somewhere else for your imaging, and then they would take you somewhere else maybe to see another doctor. And everything is a lot more patient-centered right now. So there are more things coming to you at the bedside or in the exam room. So we have to make sure we have space for all of that to happen that's sort of right around you as the patient.
And though patients are often surrounded with the hustle and bustle of healthcare, recent designs have taken a note from Disney to strategically hide the behind-the-scenes magic.
When you're at Disney World, you never see the people picking up the trash. You just see sort of the fun stuff, right? And the onstage stuff. So in healthcare, we've really been trying to focus on that. You used to be in a hospital where you'd be in the same hallway if you were a patient as the guy who's dumping the trash, right? Or maybe there's somebody being wheeled around that is not looking so great, that is in a stretcher, and it's in the same place like where you're going to go to the cafeteria to get something to eat. So we've sort of done this thing now where we've sort of separated the circulation, where there's sort of that public area where patients and families kind of are free to roam. And then there's sort of that backstage behind the house area where all the kind of nuts and bolts are happening.
Like delivering medication and supplies. It also helps cut down on the hallway traffic. By creating this separation, the staff is able to relax and have conversations without any fear of being overheard. In the past, the needs of the staff began and ended with efficiency, but now healthcare designs are starting to serve as a morale boost and mental health aid.
We used to be in an age where the patient experience was a priority, and then there was sort of a shift to a staff, and now we're kind of in this awesome age where everything is a priority.
Between the long hours and emotional toll of caring for patients, the healthcare field is both mentally and physically tough. Feldheim says many designs are now focusing on providing resources for the staff that ease feelings of burnout.
Let's say that you had a really hard day and you had a really hard patient and they are not doing well. That weighs on you as a staff member. You can't just kind of go about your day. Maybe you need a place to take a breather for a minute. So we've started creating these little rooms that we have started kind of putting in prime real estate, which we never used to do. It's along a nice wall with a nice window and a great view of the city. And there's some things in that, maybe there's a nice recliner, or we just did some that are really cool that have like little yoga mats, and they have a little sound system in there. So you can just kind of like stretch out and take a minute.
There used to be staff lounges strategically placed throughout the hospital, but Feldheim says that now they're designing entire floors to build a comfortable space for their healthcare workers.
There's a staff-only zone that you can go to that you're not going to run into patients or families, and they're not going to stop and ask you questions. They'll just give you your time to kind of have some time. All kinds of amenities that allow the caregivers to kind of have their own couple of minutes in between patients and have a really nice amenity.
However, focusing on both the patients and staff can create some challenges when the two compete for space. It's a delicate puzzle Feldheim's constantly working to piece together. But she says there's a lot of design choices that can be incorporated without taking up extra space.
It's more about the experience of, what does it feel like to be in the space? And is there intuitive wayfinding? And is there nice art? And is there biophilia and access to nature? So those are things that don't take up space. So we can kind of incorporate those really well, or, nice seating areas in your infusion rooms to make you more comfortable.
Once Feldheim's finished designing a space and the building is up and running, she goes back to see if all the plans are working how she thought they would. And with so many unknowns in the medical space, each survey is a learning experience.
It is really great as a continuous learning process to find out, okay, we thought that it'd be great to have all of these giant windows, but it turns out they just close the blinds the whole time because those windows are looking out at another building over there. So you're not getting the benefits of that access to nature because you can never see out the window. We don't do private offices anymore, which was a big problem for a lot of doctors because they were very old school and they're very used to having their own space. So that was a big mindset shift for a lot of people. And some clinicians really hated it. They really loved being in their own space. Some people really embraced it. But I think where we've struggled to implement it has been in places where we always say out of designing a project, let's think about how many, we call it a butts and seats exercise. How many people do we need to make sure the space is big enough for? And it is never implemented that way. If we decide to create a team room that's big enough for 10 people, we will find out anecdotally later that there are 15 people that are jammed in there. And so everybody is uncomfortable. It's too loud. Nobody has enough space to work. And so that's usually kind of the thing that we hear is that we had all these great ideas, but the way it was implemented was that, oh, we forgot about these people, or we have to add this or squeeze in this function.
This type of feedback is especially important when designing cancer centers.
A cancer patient has a lot of different sensitivities compared to somebody who was just going in for a family medicine appointment. You're maybe more sensitive to smell. You're maybe more sensitive to temperature or light. We design a lot thinking about those sort of sensitivities. So not putting in cafes, for example, in our cancer centers, because we want to make sure that you're not smelling things that you're not wanting to, because that's really hard to contain, Or in our infusion spaces, we like to do a lot of items that a patient can control. So if you're there for 6 hours, you want to feel like you have the opportunity to do something about the space that you're in. So can you adjust the lighting in your room? Can you adjust the temperature? Can you open and close the blinds depending on what you want to see? If it's an open bay situation, is it something that I can open and close, the door or the curtain or whatever to have privacy or opportunity to talk to other people depending on how I'm feeling that day.
Feldheim will often interview cancer patients before the design is finalized to make sure that she's addressing the actual needs of the people who will be using the space day in and day out.
I just did one that was really interesting, and just listening to them kind of talk about, these are the things that they specifically reacted to while they were on their journey. Obviously, the clinical care is top notch and they're very excited about that, but they'll notice that there weren't enough bathrooms. And so it was really hard to get around when you need to. So those kind of things we think about and we get a really good feedback from people who've been through it.
And even with all of this feedback, there will always be improvements to make. Healthcare is a rapidly evolving field that's always implementing new technology. For example, 20 years ago, architects weren't accounting for robots being the ones to move through the halls of their buildings. But that's another component Feldheim needs to think of now in her own designs.
So we have all kinds of robots now. And part of them, the idea behind it is about making sure that our healthcare teams are being used at the top of their license, right? That they're highest and best use. So it is not the nurse's best use to be moving medications from one place to another. Let's let the robot do it. So we have, there's kind of these cool small little robots, and you can kind of put meds in there from the pharmacy and then lock it and then send it on up to, somebody in room 217. Kind of those sort of things are really cool as far as things that we've seen that make a big difference in design from a technology standpoint. The thing that we do the best in a healthcare design strategy is that making things as flexible and changeable for the future is sort of the way we like to do it.
Since the entire building process takes such a long time, it may be 8 years before patients are let in, which means that customizing spaces specifically for one piece of technology would make that room out of date as soon as the hospital opens for the first time.
There's going to be a new machine that does the surgery that you haven't even dreamed of. And so making sure that we design spaces that can allow for that and allow for that adaptability and change is really I think that's kind of the way that we think the most about what's next and how to future-proof, which is a terrible term, but we use it all the time because there's no such thing as future-proof.
But as for Feldheim's best guess at what the next big change to healthcare design will be, she thinks we're moving towards more artificial intelligence integrations.
Everything that I have gone to this year, every lecture, every webinar, has all brought up AI and what that looks and feels like and how that is going to be impacting where we are. I know my personal physician, they have AI in the exam rooms. And so they are sort of listening to you as you talk to the physician and is helping the physician chart so that they can be more focused on the conversation with you and let the AI kind of do the typing. So that is kind of more of it helps kind of with your personal experience a little bit better. We shifted a lot of thinking about design because of the pandemic a couple of years ago. And so now we're sort of out of that phase and we're out of thinking about what that feels like and more back into this experience and kind of what's next phase.
You can find more information about Jodi Feldheim and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.